This presentation is on vitamins. Vitamins are organic compounds required in minute amounts for growth and maintenance of health. They are not a source of energy, but are essential for energy transformation and the regulation of some metabolic processes. Um, there are vitamins that are inactive in their native form and must be converted to active compounds. Um, there are recommended daily allowances for vitamins set by the Food and Nutrition Board of the National Academy of Sciences. These RDAs represent the average daily dietary intakes um, that all healthy adults um, would get in a particular life stage or gender group. And the intake of these vitamins is usually listed on food products. So for our vitamins, we have our fat solubles, which are A, D, E, and K, and then our water soluble vitamins, which are primarily the vitamin C and the B vitamins. What's important to know here is that if they're fat soluble, that there can be some toxicity with those vitamins because they are stored in the fat. So it's important not to take mega doses of these vitamins. With your water solubles, if you would take larger amounts, they may not be toxic, but you may have some adverse side effects from taking larger doses, but not a toxicity like with your fat solubles. Vitamin A, retinol, is involved in multiple functions in the eye. Toxicity, because of it being fat soluble, can result in birth defects, in liver injury, and bone related disorders. Deficiencies in vitamin A result in various conditions of the eye. Vitamin D regulates calcium and phosphorus, and deficiency can cause rickets or osteomalacia. The vitamin E has antioxidant properties. Dietary sources are green vegetables, seeds, and oils. Toxicity may increase the risk for bleeding, and there could be an increased risk of hemorrhagic stroke. So very important to talk to patients that may take these supplements um, because it is a fat soluble, to be careful to discuss it with their provider or with you about any risk for bleeding, and certainly if they're going to have any kind of surgical procedure. Vitamin K is required for synthesis of prothrombin and other clotting factors, and a deficiency produces bleeding. Your water-soluble vitamins include vitamin C and B. Vitamin C is required for production of collagen and other compounds that bind cells together. Sources include citrus fruits and juices, tomatoes, potatoes, strawberries, melons, spinach, and broccoli. Uh, Vitamin C is thought to have antioxidant properties, so you'll see many products of vitamin C to take when to prevent colds or if you have a cold. Um, it facilitates iron absorption, so if a patient is on an iron um, supplement, it can be helpful to tell them to take it with um, a glass of orange juice or other juice. Um, and deficiency can lead to scurvy. Vitamin B's, there's a list of those here. The first, niacin. A deficiency of niacin or nicotinic acid can cause pellagra. It can cause GI disturbances. It can cause central nervous system disturbances. Adverse effects, small dose is devoid of any adverse effects. With large doses, you get vasodilation with flushing, dizziness, and nausea. And we know that with the therapeutic use, we do use it to help decrease cholesterol levels, and patients do experience that flushing at the doses that are needed to be given, and usually don't like that effect. Riboflavin, vitamin B2, is involved in numerous enzymatic reactions. Adverse effects, none. Therapeutic uses for deficiency in riboflavin, and it is used to help with migraine headaches. And here there's discussed the two types of berry, wet berry, and fried berry. And then the Wernicke-Korsakoff syndrome, and how alcoholism is the most common cause. Vitamin B6 is a coenzyme in the metabolism of amino acids and proteins. It must first be converted to its active form. It is found in deficiency is usually from a poor diet or from inborn errors of metabolism. Symptoms are listed here, and it is rare to have a vitamin B6 deficiency in the United States, except in alcoholics. Vitamin B complex, B12, and folic acid, and both are essential in the synthesis of DNA, and deficiencies of either manifest as megaloblastic anemia. Cyanocobalamin deficiency also results in neurologic damage. Folic acid, there is food folate versus synthetic folate. Synthetic folate is a more stable form. The FDA has ordered synthetic folate to be added to all enriched grain products. A deficiency of folic acid during pregnancy can impair CNS development and result in neural tube defects, spinal bifida. So anyone who may become pregnant or is planning to become pregnant is advised to increase their folic acid intake. And folate and folic acid, there is no difference. So if someone gets folic acid preparation or a folate preparation, either one is satisfactory. Biotin is a central cofactor in several reactions involved in the metabolism of carbohydrates and fats. Question 1, the nurse is preparing a class on vitamin supplementation. What statement should be included? The answer is B. Vitamin K is required to prevent bleeding. Question 2, in which patient will the nurse suspect a thiamine deficiency? The answer is C, in the 42-year-old with alcoholism, because it is usually a deficiency is seen with as a result of alcohol abuse. Question 3, a deficiency of which vitamin is most likely to result in visual disturbances? And the answer would be A, vitamin A. And that is it for this presentation. Thank you.